Okay, we're going to switch gears and talk about renal calculi. Calculi means a stone, and the other name for that is lithiasis. So it could be called kidney stones, nephrolithiasis, or urolithiasis. So kidney stones originate in the kidney, but they can be found anywhere in the urinary tract. So some of the risk factors include factors for urinary lithiasis or nephrolithiasis include gender. Males are more prone to renal stones. It's hereditary a lot of times, especially when we talk about stones that are calcium oxalate stones. Um, Also, people that have urinary tract lining that is damaged could be another cause. Also, it's unknown. That's another possibility. Extrinsic factors include like your occupation, like nurses. If you're not able to empty your bladder at regular intervals, you may be at risk, okay? And people that are not taking in enough fluid, and also diet, which we'll talk about later. There are different types of stones. Calcium oxalate is the most prevalent and from what I've seen, the most tested. Okay. Calcium phosphate is another reason somebody can get stones. Struvite are due to an infection, and those are big stones usually. Uric acid, people that have trouble metabolizing uric acid could develop these type of stones, and cystine stones. Perhaps the first symptom of a kidney stone is excruciating colically flank or back pain. So excruciating that the sympathetic nervous system is innervated, and the patient can present with diaphoresis, tachycardia, tachypnea. They could be pale as a ghost. Um, they can have hematuria. They can be vomiting because that's sympathetic nervous system activation. If they develop shock, which is a possibility, they'll become hypotensive. But most times, due to the excruciating pain, they're going to have hypertension. Okay, now the renal stone can cause urinary obstruction, hematuria, like we talked about. They could become infected, like kidneys could become infected, and they can develop what's called hydronephrosis. Now, hydronephrosis is when, if you look at this picture with the kidney, see there's a stone there in the ureter, so that's obstructing the flow of urine. So therefore, the kidney pelvis has got water on it, right? In other words, the urine is backing up, so we call this hydronephrosis. The danger in this is that this can produce a post-renal AKI. And I know I haven't talked about AKI yet, acute kidney injury, but that's what you're looking for if there is a decrease in urinary output. Now, the other kidney could be fine, so they could still be putting out urine, but that's something you need to look out for because oliguria or anuria is a medical emergency. All right, nursing management. That patient is going to need pain medicine. It is excruciating, colically flank pain. So either morphine or ketorolac. Hot baths and moist heat might make them feel a little bit better. They need to drink a lot of fluid to try to flush that stone out. Encourage ambulation to pass the stone. They may be given IV fluid to flush the stone out. Monitor the INO. We strain all urine, and send any stones we find in the urine to the lab for analysis. They can determine what type of stone it is. And monitor the urinary pH. That's another thing that needs to be done. Depending on this type of stone, they'll have to avoid foods. Now, the calcium oxalate is the one I would concentrate on the most because this is the most common and the most highly tested. So they need to avoid spinach or limit, Swiss chard, which is like a green leafy vegetable, black tea, coca, and Coca-Cola products types, and pecans, rhubarb, peanuts, and limit sodium. If they can't pass the stone, they may have an ESWL, stands for extracorporeal shockwave therapy. So with this, after the procedure, you would expect hematuria and flank bruising. You're going to strain all urine. There may be like some sand in it from the breakup of any stones, and you're going to monitor for dysrhythmias because it does use shockwave therapy. So monitor for dizziness, weakness, decreased exercise tolerance. If they tell you they have palpitations or an irregular pulse, that may be an indication that they have a dysrhythmia after this procedure. So it's important to monitor for that.